Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see another test that is related to the mineral. So this test is about the fluoride test. If you guys remember, we already talked about different tests that is related to the mineral. Like we have talked about sulfur test, iodine test, chlorine test, chloride test. We have talked about the calcium test. Okay, so if you wanted to watch all these videos lecture related to the electrolyte and minerals, there will be a playlist of electrolyte and minerals, so you can go back to my channel and watch this playlist. Okay, so now in this video we are going to see the fluoride test in detail. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. First of all, let's see that what we are going to explain in this video. So in this video lecture we are going to see that what is fluoride function of fluoride test. Then we are going to see the diagnostic purpose of fluoride test, test procedure, normal range, and main causes of high and low fluoride. First of all, let's see that what is actually the fluoride. Remember guys, fluoride is actually the chemical compounds which contain an element which we call that fluorine. And what is actually the fluorine? Fluorine, all of you better know, it is the gas, yellowish gas, and it is present in the periodic table. Moreover, it belongs to the halogen group. Now how fluoride can be formed from the fluorine? So remember, when fluorine gain an extra electron, so then it will be converted into the fluoride. Then we have the occurrence of the fluoride. So fluoride is mainly found in the minerals, okay, and it is also found into the drinking water, especially in mineral water. Moreover, the fluoride is also found into the toothpaste, which help to prevent the dental cavities, means help to prevent the teeth from the bacterial infection. Then fluoride is also found in the eating food, like we have black tea, green tea, salmon fish, and also it is found in the form of a tablet. Now let's see what is the diagnostic purpose of the fluoride. So dear viewers, fluoride test is important to monitor or to check the appropriate treatment, means what type of the treatment should be needed for the patient that have the fluoride issue. Means if they have dental issue like dental plaque, like dental cavities, so due to this test we can guide we can provide a special type of the treatment, and due to this test we can also make sure that either the treatment is workable or not. Due to the fluoride test we can also diagnose the health status of the teeth and bone. Due to fluoride test we can evaluate the kidney and renal diseases. Moreover, due to fluoride test we can also check the level of the fluoride in the body. Now let's see the procedure. So it's very simple. You can also perform the fluoride test from the urine and fluoride test from the blood. Let's see that how to perform the fluoride test from the blood. So in this case you need the blood in gel tube, red top or green top. Then what will you do? You have to centrifuge the tube and will separate the serum and plasma. Once you get the serum or plasma, then you will run it on an advanced machine, like fully automated machine, like we have Selectra, Mendre, okay, and Meglomi. Now let's see the normal range. So in drinking water, if you want to drink the water, so the fluoride level will be 0.7 milligram per liter. Now if you see if you wanted to check out the fluoride level in the urine, so it should be 0.5 to 2.0 milligram per liter. Now the fluoride level in the blood should be 0.1 to 0.5 microgram per milliliter. Let's see the main causes of high fluoride in the blood. So if let's suppose the fluoride level get high in the body, so it is due to the drinking of fluorinated water, like we can say mineral water. It is due to the consumption of the fluorinated contaminated food, like we have salmon fish, we have black tea and green tea. It is due to the overuse of the toothpaste, okay. It is also, now if let's suppose the fluoride level get high in the body, So there will be GIT, liver and heart issue. There will be also kidney, thyroid dysfunction, bone cancer, neurological and reproductive health effect. Due to high fluoride, it may cause nausea, vomiting, abdominal pain, muscle weakness and tremor. And due to high fluoride, it can also cause the skeletal fluorosis, like we have joint pain, stiffness, bone deformities, restricted movement, osteosclerosis. Okay, so dear viewers, this is all about the fluoride test. I hope you will get a lot of information from this test. If still you have any question, you can write your question into comment. I will try my best to give you answer as soon as possible. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that. Thank you so much for watching.